Oh, hi there. My name is Ken Anson. I'm a consultant urological surgeon, and I'm based at 18 Devonshire Street and the Princess Grace Hospital. It's a very good question, and I've been asked this many times as to why I became a urologist. I think a lot of it comes back to inspirational characters and leaders that I met during my training, and I was lucky enough to meet a number of really good, excellent urologists when I was a young training surgeon, and they were inspirational. Particularly about the way they interacted with patients and the use of the very high technology that we have available as urologists to treat the patients. I also enjoyed the population that I was looking after. I have been lucky enough to treat children all the way through to very elderly gentlemen, up to, in fact, the oldest patient who's had a prostate operation that I've treated was 101. So wide range of people, lots equal gender split, and high technology and inspirational leaders, I think, are the keys to why I chose urology. Well, just practicing medicine in itself is a great privilege and very rewarding, being able to enter people's lives at a time when they're very vulnerable, and to try and help them through their illness journey is rewarding. What's particularly challenging for a surgeon is to take a patient to the operating theatre and try and sort out their problem so that they recover fully without any impediment from the intervention that we've carried out. And when that is successful, it can be remarkably rewarding. There is nothing really that compares to that. When patients come and see us, obviously the most important part is actually taking what we call the history. In other words, talking to the patient and trying to find out and tease out the most relevant aspects of what's happened to them to try and establish a diagnosis. I was taught as a younger consultant that 90% of the diagnoses are made from the history alone, from the story alone. And then, of course, we have the wondrous imaging and backup laboratory tests we can do to test the diagnosis you've already established, and so that we can then establish a firm diagnosis for the patient. And based on that diagnosis, we can then offer them the most appropriate management or treatment option for that. So I would hope what patients can expect is a straightforward approach. I hope I use language that they can understand to help them together with me on a patient journey, if you like, to find out exactly what is wrong and then tailor an appropriate treatment regime for them, or indeed in a number of stone patients, actually, they don't need any treatment and just a lot of reassurance.